Hi there and welcome back to my channel. My name's JBRNBSN. I am currently a registered nurse in the state of New York, and today I'm going to share with you what I've learned and discuss Next Generation NCLEX. This is for those who are eligible to take the NCLEX RN PN by the time this project will be implemented by the National Council of State Boards of Nursing. But before I begin, please don't forget to support my channel. Please click that like and subscribe button. Please share this video to your friends, and don't forget to comment down below and I will answer those comments as soon as I can. So let's begin. The Next Generation NCLEX target date of implementation by the NCSBN is April 2023, and the date of implementation may or may not change, and decision depends on NCSBN. NCSBN is still continuing their research and analyzing data as of February 2022, so this project is not yet in the final stage. The Next Generation NCLEX is more on case studies, so you will be presented with patient clinical scenarios, chart reading like reading nurses' notes, and based on that nurses' notes or patient clinical scenarios, you will be tested and given questions. The goal of this project is to enhance the current NCLEX exam to measure the novice nurse's clinical judgment in providing patient care and safely practice the nursing profession in today's rapidly advancing healthcare system. So the Next Generation NCLEX is up and coming by next year, so you still have time to take the current NCLEX until March 31st of 2023. So you have more time to prepare. According to NCSBN, research shows that 65% of nursing errors result from poor clinical decision making, and 50% of novice nurses are involved in those errors of nursing care. Next generation nurses will need to make complex decisions about client care, and to meet today's client needs, improved measurement of the nurse's clinical judgment is crucial. That's why NCSBN is developing Next Generation NCLEX to minimize errors in delivering patient care in today's rapidly advancing healthcare system. Clinical judgment is a combination of critical thinking and correct decision making. NCLEX Next Generation will focus on measuring clinical judgment, which includes interaction between nurse and client, the client's needs, and the expected outcomes of care. So what are the new types that are included in the Next Generation NCLEX? They are the extended multiple responses, also known as select all that apply. We have the extended drag and drop, close or drop down, enhance, hotspots, the matrix grid. So 5 new question types are included in the Next Generation NCLEX. Test takers may still receive and answer standalone multiple choice questions and other current NCLEX RN and PN question types. However, majority of the question types to answer are mentioned above in case study format. New question types reflect real-world nursing care and focuses on the types of decision the nurse will have to make in the clinical setting. So this would really measure the novice nurse's clinical judgment skills. So let us discuss each new question type, and I will give you an example too for each type. So the first one, extended multiple response. It's still the same thing with the current NCLEX. The difference is that they just added more options to select. So it would be more difficult than the current one. So the current one usually has only 5 items that you can select for your answer, but for the next generation NCLEX, you will be given maybe by 6, 7, 8, 9, or 10. Depends on the question. For example, here, a 2-month-old infant has been diagnosed with pyloric stenosis. The nurse at the healthcare clinic educates the mother that the following signs and symptoms are indicative of the diagnosis. Select all that apply. So the items that are given are olive-shaped mass in the abdomen, current jelly stools, strawberry tongue, projectile vomiting non-bilous, and visible peristalsis. So the correct answers for this is, in the testing center on the computer, you will check olive-shaped mass, projectile vomiting, and visible peristalsis, because these are signs and symptoms of pyloric stenosis. Current jelly stools is a sign and symptom of intussusception, and strawberry tongue is a sign and symptom of Kawasaki disease. So for the next generation NCLEX, they just added 5 more options to select. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that's the difference between the current and the future extended multiple response question in the NCLEX RN or PN. And there's a side note here, in 2021, as proposed by the NCSPN exam committee, a partial credit may be given to a correct selected answer. However, a point will be subtracted or deducted for every incorrect selected answer until a test taker gets 0 for that item question, when the NGN will be implemented in April 2023. Exam committee will vote in order to approve the proposal. So if majority of the votes approve the proposal, then this will take effect in the new NCLEX RN PN called Next Generation NCLEX. And for NCLEX Next Generation, as what I've said, they just added more options to choose from. So that's the difference between the current and the Next Generation NCLEX when it comes to extended multiple response. Let's proceed to extended drag and drop. So extended drag and drop is your order response questions in the current NCLEX. So in the current NCLEX, you drag and drop all the items in chronological order in the next column based on the question being asked. For example, you are being asked to identify the correct order in performing wound dressing. So you have to order the steps on how to do wound or perform wound dressing. And all the items are included in answering the question. So everything must be transferred to the next column and you order the steps. And then all items are correct and related to the question. However, in the Next Generation NCLEX, you will only drag and drop selected items from the first column to the next column based on the question given. And not all of the items are included in answering the question. Some items given are incorrect and unrelated to the question. And you need to identify which items are to be dragged and dropped in the next column to answer the question. So when you answer the Next Generation NCLEX extended drag and drop, not all of the items are related to the question, so you need to identify the items that are needed to be drag and drop, and then you order the steps in order to answer the questions that were given to you. So the next is close or the drop down. So the close and drop down, you as the test taker must read and complete the sentence or phrase by clicking the drop down menu and choose the correct word that completes the sentence or phrase. For example, I have like a sentence or phrase here, and then the blackened portion, for example, is the drop down menu. So for example, a 47-year-old male client was brought to the emergency room with hypovolemic shock. Upon checking the blood pressure, he is. So when you click the drop down menu, you would select either hypotensive or hypertensive. In this case, you click hypotensive because the male client is in hypovolemic shock with warm or cool skin to touch. The correct answer is cool skin to touch. Click cool. And then it is expected that the laboratory results show increase or decrease of sodium level in the client's body. So when you click the drop down menu, you click decrease of sodium level in the client's body. And then the best IV fluid replacement therapy for the client is hypotonic isotonic solution. So if this is a drop down menu, click it and then see you select. In this case, the correct answer is isotonic solution. So that is for your close drop down test type question for the next generation NCLEX. The next test type is the enhanced hotspots. So you have to select the answer by highlighting preferred words or phrases in a paragraph that answer the question. For example is, click to highlight the findings that would require follow-up. So in this case, you'll be given like a scenario, a patient scenario, or you are advised or instructed to read nurse's notes. For example, the client at the emergency room is receiving blood transfusion at 120 ml per hour. Current vital signs while on blood transfusion: heart rate of 72, blood pressure of 110/70, respiratory rate of 20 breaths per minute, temperature of 105 or 40 degrees Celsius, pain of 0 to 10 at this time, blood glucose level of 67 milligrams per deciliter. So in this first sentence, is there something that you need to highlight that would require follow-up? Yes, there is. You have to highlight the temperature of 105, temperature of 105, 40 degrees Celsius, and also you have to highlight blood glucose level of 67 milligrams per deciliter because these vital signs would require follow-up. In this case, maybe there is a reaction to the blood transfusion because the patient has fever and also the patient is experiencing hypoglycemia. So to continue, the client has a medical history of hypertension and diabetes type 2, has been prescribed by his family doctor with telmisartan 80 milligrams once a day in the morning at 7 a.m. and metformin 1000 milligram once a day with evening meal since last year. The healthcare provider ordered dextrose 5% in water to be administered with ongoing blood transfusion. The client states, I'm always being transfused with blood every time I am admitted at the hospital. The client seemed to be upset and irritable. The client suddenly complains of shakiness and headache. So, what would require follow-up? So the answer would be HCP ordered dextrose 5% in water, which is to be administered with ongoing blood transfusion. So the IV fluid that needs to be administered, the only IV fluid that needs to be administered with the blood transfusion is normal saline, not dextrose 5% in water. So this requires follow-up. It means that the nurse will question the doctor's order and he or she needs to contact the healthcare provider because this is incorrect. So it needs to be highlighted. That is correct. What else do we need to highlight that require follow-up? So clients seem to be upset and irritable. Irritability is a sign and symptom of a person who is hypoglycemic or has hypoglycemia. Also, the client suddenly complains of shakiness and headache. So irritability, shakiness, and headache are signs of hypoglycemia and it needs or requires follow-up. So the next type of question is matrix grid. It allows you to select one or more option for each row and column This type of item can be useful in measuring multiple aspects of the clinical scenario with a single item. For example, the nurse is assessing a male client after performing urinary catheterization. For each finding, click to specify whether the finding indicates the intervention was effective, ineffective, or unrelated. So in this kind of question type, you will see 4 columns, a table with 4 columns, and then there is an assessment. It could either be 1, 2, 3, 4, 5, 6, 7 assessments. In this case, for example, I just gave 5 assessments that needs to be answered. So to answer this question, let's go back. The nurse is assessing a male client after performing urinary catheterization. The first assessment is urinated 150 ml of urine 4 hours after the procedure in the urine drainage bag, or what we call the Euro bag. Is this assessment effective, ineffective, or unrelated? The correct answer is effective because the client was able to void 150 ml of urine after 4 hours. Remember, the normal urine per hour is at least 30 ml. So 30 ml times 4 is equal to 120 ml. The client just voided 150, which is more than 120 ml. So this assessment is effective. The second assessment is distended bladder. So if the client has been catheterized and then the client still has distended bladder, it means that the urinary catheterization of the client wasn't effective or did not work. So in this case, you have to click ineffective. So in the computer at the testing center, there's a small box here. Then you have to click ineffective for distended bladder. Next assessment, early decelerations. So when we talk about early decelerations, we're talking about a baby that's moving in a mother's womb. And for that, early decelerations are for pregnant women. Remember, we have a male client. So a male client cannot be pregnant. So this one is unrelated. So you have to be careful and learn your medical terminology. So early decelerations are for pregnant women. This is unrelated to the problem because this is a male client and they're just performing urinary catheterization. Early decelerations are for pregnant women, which is unrelated. So click the box for unrelated. Then we have gum bleeding. Is gum bleeding have to do with urinary catheterization? I don't think so. So this gum bleeding is unrelated also. So you have to click the small box here for unrelated. So eliminated residual urine. So since the client has catheter inside, the residual urine has been eliminated because of this nursing procedure, which is urinary catheterization, and the client was able to void. So it has eliminated the residual urine. So this one is effective. So you click effective. So for the assessment, the first assessment was effective. The second one was ineffective. The third and fourth is unrelated. And the last assessment, eliminated residual urine, is effective. So that's how you will answer matrix grid. Thank you for listening to me. I hope I was very helpful to you. If you haven't done so, please click that subscribe button. Please like and comment and share this video to your friends, classmates, to other nursing students or nursing graduates that you may know of. See you in the next video. Take care and happy nursing.